Acne is one of the most common skin conditions in the world. I'm Dr. Emma Craythorne, a consultant dermatologist, and I'm going to give a deep dive into acne, the kind of things I tell my patients in clinic, why we get acne in the first place, and what we can do to help. When we think about acne, we want to start right back at the very root of the whole problem, and that is the hair follicle. If you imagine your hair follicle, it acts as a little tract that comes down into the skin. If you look on the back of your hand, you can see lots of these little pore openings. Well, if you imagine taking a deep dive down that pore, you will end up coming to the hair bulb, and the hair bulb sits at the bottom with a fine hair that comes out of the top of it. So each one of those little pores on the back of your hand have a tiny little hair. Within that, there is also something called the sebaceous gland, and the sebaceous gland releases its content, the sebum, and it comes up through that little tract and out onto the surface of the skin where the hair is. And this is the root problem of what happens in acne. So the very first step that tends to occur is that there is more sebum made. Now, that can be because the sebaceous gland is under kind of lots of hormonal control, which you can sometimes see in terms of puberty, or you can see this in perimenopausal and menopausal women. You can also see it as a consequence of stress, and stress can drive the sebaceous gland also to make more sebum. When that sebum is made, in many cases, it is often a bit thicker than usual, and that thickness and volume of the sebum starts to clog up the follicle. It's coupled then too by the lining of the follicle and the skin cells themselves becoming a bit more sticky, and they don't turn over in quite the same way that they should do. So right down this follicle, you have this mixture of increased sebum thickness, as well as more of these skin cells. What then happens is it's trying to then leave the follicle, and oftentimes it then gets stuck. And it gets stuck at the top, and it can often be referred to then as a blackhead because the sebum oxidizes with the air and it leaves this black dot on the surface. That black dot can actually feel a little bit hard because almost like a plastic vulgarization process, it becomes a bit thicker. The other thing that can happen is you can then have a whitehead or a closed comedone, where it's almost like the skin is sitting on top of where the sebum would be. So oxidized sebum that's black is called an open comedone or a blackhead, and then non-oxidized sebum, which is just this kind of regular sebumy yellowy color, is sitting with the skin over the top of it called a closed comedone or a whitehead. So this is the precursor really of comedonal acne. What can then happen is that the microbiome on our skin contains lots of different bacteria. And the bacteria of interest in this particular case is something called Cutibacterium acnes. And Cutibacterium acnes can get caught up in that whole comedone itself and start to release substances that end up making the skin a little bit more inflamed. That inflammation can then turn this comedone into a red spot that we think of as being a papule. This can further go along where you're getting more inflammation and pus can start to form, and that makes a pustule. And now we're into the realm of the papular pustular acne. So we've moved from that comedonal acne into the papular pustular acne. What can then happen further for some people is whenever the immune system then comes in and takes over. And for some, that can be helpful for controlling things. But for others, it can be very destructive and can end up rupturing that follicle, and all of that inflammation ends up within the dermis and the subcutaneous fat. And that is what can end up causing these kind of like pseudocysts, or what we often think of as a nodular or a cystic acne. So these are really the different kinds of lesions that occur within the skin whenever somebody has acne. So why do some people get acne and others don't? Well, there's a few different factors at play, and certainly genetics, as always, is one of the main kind of agents at play. So if your parents had acne, have acne, or if your siblings have acne, then you yourself are much more likely to develop acne. Other things, this comes in particularly for women, is hormonal changes. And for some women, a condition called polycystic ovarian syndrome, which is a pretty common condition which results in acne forming, hirsutism, loss of hair at the front of the head, difficulty in losing weight. These kind of symptoms are what we would see in polycystic ovarian syndrome. So people with that are more prone to having acne. We also know that people who have a lot of a high glycemic index food, in other words, lots of sugary or processed foods, are more likely to be in that sphere of developing acne. Stress can contribute to acne, and certain medications, so particularly medications that bodybuilders might use, that can tip you over to having acne, and other treatments like steroids. But the main cause really for developing acne are these changes in hormones, and that can be either in puberty or for adult females associated with coming off an oral contraceptive pill following a pregnancy, or in the perimenopausal time where there is this fluctuation in hormones that can occur and a change in how androgen ratio might present to the follicle. Adult female acne, or sometimes called hormonal acne, is becoming more problematic, and this is something that we are seeing more in our clinics over time. It is difficult for women because quite often acne is something that is associated with the teenage years or very, very early adulthood. But in the case of adult female acne or hormonal acne, that acne may well have never left since teenage times, and that person may now be in their 30s or 40s. Or for some, it may well be associated with having been on the oral contraceptive pill and then stopping, or following a pregnancy, or as a consequence of changes and fluctuations in that perimenopausal time. It's also not as straightforward as teenage acne, because adult female acne skin is often different in terms of the sensitivity that it might well have and the kind of products that can be used to treat it. And what we might think of as being a very gold standard treatment for a 15-year-old with acne actually is quite different, although the active ingredients are the same, to that we could give an adult female. In addition, certainly oxidative stress, in other words, additional pressures of life, very much play a role, more so in adult female acne compared to that of puberty. So things like poor sleep, poor nutrition, anxiety, stress, diet are all having an impact as well. How to tell if you have adult female acne? Adult female acne is something that tends to occur, by the name it suggests, in adult females, and it can be in your 20s, 30s, 40s or 50s. It often presents on the lower part of the face or the chest, and these are areas that are a little bit more sensitive to circulating androgens, or may have been sensitized within the follicle itself. It's essentially making more of this androgen that's going to be stimulating the production of oil. So that's why they tend to present in these areas. What's interesting is they don't tend to present often with the open comedones or blackheads in quite the same way, but more closed comedones and deeper rooted papules and pustules. It can often be associated with a condition called polycystic ovarian syndrome, and this condition is something that can occur alongside hyperinsulinism. In other words, the insulin levels are high at the same time, as well as a change in other female hormones. Other symptoms that go alongside the acne are something called hirsutism, where hair may well grow on areas that wouldn't be expected on a female. So for example, the beard area, the moustache area. It can also be associated with thinning or loss of the hair in these areas where you get this temporal receding. It can also be associated with people who really do find it difficult to lose weight. And no matter how much they try or they exercise or their calorie restriction, it is almost impossible for them to reduce their weight. And so you will also then find in this group of people there will be fluctuations or changes perhaps in their periods. They may be very irregular, they may not even exist at all. And those constellation of symptoms are associated with PCOS, and we see that in adult females often presenting with acne. We treat acne depending on what the symptoms are in front of us and depending how severe this is. The gold standard cornerstone of treatment for acne is retinoids, and that is in the form of either adapalene or tretinoin, and not the form of retinol, retinal, retinaldehyde. These are over the counter, they are not drugs, and they should not be used in your treatment of active acne. The drugs that should be used are either adapalene or tretinoin, and they should be used in doses of 0.1% for adapalene or 0.025% of tretinoin or higher than that. These are nightly treatments, and they work by targeting that very beginning part of the comedone to stop it from becoming blocked in the first place. So this area where the follicle has made a deep dive down into the skin and where the hair essentially is coming out of the follicle, that is the part that gets blocked and then ends up causing the comedone. And the retinoids work by stopping that blocking from occurring. It allows the skin cells to flow more freely, to be less sticky, and then being less sticky, then you reduce the risk of the comedone developing. So that is the cornerstone of treatment across the board for all kinds of acne. That is first and foremost the most important topical ingredient we have. The next topical ingredient we have that is very useful for treating acne is azelaic acid, and that's particularly at a 20% azelaic acid. It works by calming down the inflammation within the skin by acting as an antioxidant, but it also has an effect on the bacteria that's otherwise trying to get into the comedone to move this on to becoming a papular-pustular acne. The use of benzoyl peroxide is incredibly helpful, and this can be used as a wash as well as a topical leave onto the skin. The slight issue with this ingredient, especially for adult females with acne, is often it can be too irritating on their skin barrier and they do not like it, but it is a very good treatment for acne. Topical salicylic acid at a strength of 2% can also be helpful for comedonal acne, as can 4% nicotinamide. These are all very good active treatments for those comedonal stage of acne. When we move on to the papular-pustular form, all of those things I've already said hold true, but we're now in the realm of having to add in additional treatment. For adult females with acne, my usual go-to is considering the combined oral contraceptive pill, but also considering the use of spironolactone in doses up to 100 milligrams. There was a very interesting study published in the British Medical Journal looking at the effectiveness of spironolactone and really considering this should be more of a first-line treatment over antibiotics for adult females with acne. We can often then think about using antibiotics. Now, interestingly, antibiotics are used in a slightly different dose for acne, and a lot of it is related to the anti-inflammatory effect that those antibiotics actually have. When we come to think about antibiotics, you're really starting on a 3-month course to see if this is going to have some improvement at reducing that inflammation that's happening in the skin. You have to do this alongside topical treatment. The antibiotics are not targeting the root cause of acne, and so as soon as you stop them, unless you've got something else in place topically, the acne is most likely to recur. When we think about adult females with acne that you're considering using spironolactone or the oral contraceptive pill, these are really effective, but they don't work straight away, and you should allow at least 4 months on the treatment before you'd be deciding whether it was effective or not. Moving on, and once we're in the sphere of cystic acne, this is really at risk of scarring. And in fact, if somebody has already had scarring from their papular-pustular acne or have failed other acne treatments, that is when the drug isotretinoin is used. This is a very safe drug when used correctly, and it is a drug that is life-changing for acne patients. It is likely to permanently clear the acne, and that will not come back again. And that happens in about 85% of people. It has to be monitored very, very closely because it does have some significant side effects. But all in all, most patients tolerate this exceptionally well, and their outcomes are much improved compared to having had the severe acne in the first place. Acne skincare routines. Well, everybody's acne skincare routine will be different. The core treatment that's going to get in there and actually be the topical skincare ingredient that's going to be helpful will likely be topical tretinoin, topical azelaic acid. These are in the forms of a medical treatment and they're applied at night time. Now, the rest of it really depends on what the person is like in front of you and a detailed examination of their skin. But usually I might go for something like this. A wash in the morning with 5% acne side gel. So not using it as a gel, but just washing the skin with it. And then applying something like a La Roche-Posay Effaclar H as a moisturiser and the La Roche-Posay oil-free SPF from Anthelios. That's a really nice morning routine. And then at night time, I would suggest washing the face with Cetaphil Gentle Cleanser and then applying your nighttime topical treatment, which is likely to contain tretinoin at 0.025% at least, and 20% azelaic acid. And then depending on how that controls things, you may or may not be adding in antibiotics. And depending how that controls things, you may or may not be adding in oral retinoids. So that's an example of that 17-year-old boy. For a 42-year-old woman, this is different, and hers may well be related to changes within her perimenopausal cycles. Certainly she seems to have a hormonal acne on discussion. And so with this particular patient, I am going to give her something nice and gentle for the skin. She will have Cetaphil Gentle Cleanser as her moisturiser. We're going to use Lipicar, which is quite a thick, creamy moisturiser from La Roche-Posay, and then her SPF. And I'm using the Day Script from Klira, the dry and hyperpigmented form. And then at night time, I'm going to be applying to her 0.05% tretinoin and her 20% azelaic acid topically. And that is her really nice routine. If that's not enough, I will add in spironolactone at 50 milligrams and then increase that to 100 milligrams after a month. And if that is still not enough, we consider changing or perhaps altering or adding in HRT if that's appropriate, or oral retinoids if that is appropriate. So you can see the two different ways in which we can think. So there's certainly not one size fits all acne treatment, but the core ingredients of managing the hormones, appropriate topical prescription retinoids and not over-the-counter retinoids, azelaic acid, benzoyl peroxide, these are all very effective ingredients. Accessing treatment for acne within the UK can be done directly with your general practitioner. It can also be done with your private dermatologist or within an NHS dermatology appointment. And it can also be done with many of the dermatology online prescribing clinics. The key is to get in and get the appropriate treatment that your skin is able to tolerate so it doesn't progress on through these stages of acne. It is really important to try and get this under control to stop further scarring, but also because acne has such a significant impact on the quality of life that you have. You know, it affects every conversation you have with people. It can affect your job. It can affect how well you're doing at school. And so getting in and getting treatment to get this under control is a top priority. So these are all ways in which you can access acne treatment. Before seeking out any individual ingredient to treat your skin, you need to ensure that you understand your skin correctly and you have the right diagnosis. A great place to start to get a bit more information about your skin is to go to www.klira.skin.